Are you okay? Is something wrong? Or can I help you? Those were quite literally the only words I desperately needed to hear the day I found myself standing atop that bridge, believing beyond a shadow of a doubt that I had not one other course of action to take but to die by these two hands from said lethal emotional pain.
Oh, I can't say enough about what we do with Meridian, bringing these services and these type of events to the communities, not just in Muncie, but different locations throughout the state. It decreases the stigma totally across the board, that people feel comfortable with talking about that. The audience feels comfortable with coming and listening to what we do.
There's a stigma, right, associated with mental health, with suicide, and so getting this word out, having somebody like Kevin come in who survived and is now helping others.
Anything that's complex and difficult, I think it deserves a lot of discussion and thought. It's not something we can just simply go after and say, this is what we're going to do and we're good. And when we talk about these discussions, I can tell you across the state, communities differ, counties differ. And so when you have these discussions locally, you can really get into the nuances of what needs to change.
Since I first began speaking on the subject 22 years ago, 7 months after my attempt, I've seen a lot more empathy, a lot more awareness, and a lot more understanding from people all around the world. One of the things Meridian Health does very well is give empathy, understanding, and compassion to those in desperate need who are in pain, what I call brain pain.
I think Kevin's a great speaker. It's amazing how he's able to sort of really bring that emotion in. And I think what it does is, for folks who maybe don't have his lived experience, this really brings these issues home.
His story is unique, I think, because he survived jumping off the Golden Gate Bridge, but he also talks about in his story why reaching out when you can tell somebody's struggling is so important. And I think that energy can really move things forward in terms of us thinking about how can we do better at supporting others.
I think both awareness and education of what the need is in the community, helping others understand that we want to break down the stigma about seeking help for mental health, and then also access. Maybe there's someone in this room today that's going to help increase the access to mental health services in our area.
They can call out to the National Suicide and Crisis Hotline. They can call out to Indiana Crisis Hotline. They can seek out emergency services in general, just call in 911. If you're unsure of what direction things should go, reaching out for help is better than not doing anything.
Stories are 22 times more memorable than statistics or facts. When you hear a story, your brain actually syncs up with the storyteller. The neuroplasticity of the brain, when you hear a story like mine, actually allows you to feel such a deep sense of empathy where you're actually putting yourself in my shoes. And when you hear the story and you hear it not just of pain and struggle, but of triumph over adversity, you end up feeling this immense sense of hope, which is incredible.